Little Rock Marathon runner collapses mid-race, suddenly dying from an enlarged heart. Well, his family is now pleading with the public to honor his memory by getting a heart screening. THV 11's Shelby Danielson tells us how this unexpected incident is all too common.
Well, Dawn, high endurance athletes are so well conditioned that they often mask the usual symptoms of an endangered heart. Recall basketball stars Pete Maravich and Hank Gathers, and now Little Rock runner Jacob Wells, all victims of a failing heart. But their tragedies teach us an important lesson.
1 minute to the next, you could be totally normal and then suddenly collapse.
That's exactly what happened to college basketball star Hank Gathers.
With the Hank Gathers situation, it's still possible that even with medication, he may still have collapsed. So it's a little controversial.
An NBA star in the making, Gathers shocked the nation when he suddenly fell mid-court, dying shortly after. The All-American forward was living with a heart condition called hypertrophic cardiomyopathy, an enlarged heart.
It's a difficult situation when you're a competitive athlete and you depend upon your performance, and that's reduced by either medications or the condition that you have.
But his story is all too common.
In the situation of Jacob Wells, he had a dilated cardiomyopathy, is my understanding.
Local runner Jacob Wells died back in November after collapsing during a marathon in Wynn.
The tragic thing is that his condition wasn't recognized in advance.
The autopsy posted on the Facebook page dedicated to Wells revealed an enlarged heart, a disorder that is usually genetic.
Sometimes the symptoms are pretty subtle, especially in athletes who are used to performing at a high level.
The tragedy left the running community in shock.
Probably the most common cause of sudden death is going to be an electrical problem, such as an abnormal heart rhythm. Those are things that can come on suddenly. They're unpredictable.
Now rewind to March of 2012 when 37-year-old Mike Kelly decided to run in the Little Rock Half Marathon after shedding 40 pounds. He collapsed and died at mile 11. Toxicology reports revealed a similar story: cardiac arrhythmia and irregular heartbeat, which turned fatal due to overexertion.
It's important to remember that there are risks to everything that we do.
Fortunately, there is something we can do about it. We can keep our heart in check.
Important cardiovascular symptoms, I think, to recognize would be shortness of breath, chest pain or chest pressure, feelings of your heart racing, and certainly if you feel dizzy or lightheaded or you pass out, should cause you to seek attention of a healthcare provider.
And Dr. Sherbet says this isn't cause for athletes to quit high-endurance sports. It's just a reminder that it can happen to anyone at any time. Dawn?
All right, Shelby, thank you. And again, friends and family of Jacob Wells encourage us all to ask our doctors for a heart screening, even if we don't have any symptoms.